Okay, we'll get started here in just a second, guys. Sorry we're a few minutes late. All right, everybody. Thanks for being patient with us. We're sorry we're a few minutes late. Had some technical difficulties, but we are ready to get started. So today we're going to be talking about posture, all about posture. There's a lot of common problems that we see here in our clinic, and most of them are pretty easy fixes, just with some education and some just a few pretty simple exercises. So we'll be going over those today. My name is Josh Elzy, Doctor of Physical Therapy, and I'm working here with Frank Romney here at the Ogden Athletic Club. So if you're joining with us live, we appreciate you. And if you find this of value, we hope that you'd share it with your friends and family. And we really hope that if you do have a problem, that you'd come and see us. Give us a call. So why is posture important? Okay, I think we all know that it's important, but why? So here's just a few of the many reasons why posture is so important. Okay, so good posture, you'll have less low back pain and neck pain. Okay, you'll have less headaches, you'll have increased energy levels, you'll have less shoulder and neck tension, less wearing on the joints. Okay, increased lung capacity, improved circulation and digestion. You'll have better core and scapular strength, better form during your workouts, which is really important. Okay, if you're exercising with bad form, bad posture, that's when you're going to injure yourself. That's when you get hurt. Okay, you'll look taller. That one's important for me, and you'll have more confidence. So posture starts with your feet. Sometimes you wouldn't think that, but if you have a foot posture problem, that can affect everything up the chain. Okay, so it's really common for us to see here in the clinic what we call hyperpronation. That basically just means you have collapsed arches. Okay, so collapsed arch. So you see the top picture here. Normal arch, you should have a good little arch there under your foot. If you don't, if it's totally flat, that's putting a lot of stress on the joints of your foot, and then that will affect the mechanics of everything up the chain. So you'll see knee pain, hip pain, things like that. One thing that you can do real easily at home to check to see if this is a problem is, well, first, take a side view glance at your foot from the side, right? If you can't put like a finger or two under your arch while you're standing, and your foot is just totally flat, then you've obviously got a problem. But another way that you can check is by having somebody else, or looking in the mirror, look at the Achilles tendon in the back. Okay, we call this the rear foot angle. So normally, if you've got good foot posture, your Achilles tendon, right? So the one that comes from your calf muscle, the big tendon that goes down to the heel, that should be pretty straight up and down. If you see that kind of curves out, like you can see here, that is kind of demonstrating the arches are kind of collapsing. Okay, so if that kind of curves out like that, the Achilles tendon, that's an indication that you've got some problems with your foot posture. The arches are collapsing. So a really simple exercise to kind of work on this. There's a lot of things that we do, but we'll just give you guys one simple exercise that you can maybe go look up and try. It's called the short foot exercise. Okay, so essentially with the short foot exercise, you're trying to kind of make your foot shorter. So you're trying to kind of pull your big toe closer to your heel, and you're trying to accentuate that arch, and you'll feel some of those muscles in your foot trying to work. Now for some of you, that exercise might be really hard. Others of you, it might not be so hard, but that is an example of one exercise that you can do to work on this if you have this problem. Okay, moving on up the chain, there are a lot of posture problems that can originate from the hips. Okay, so your hips are kind of your center, right? They're your core. And if you have tightnesses in certain muscles or weaknesses in certain muscles around the hips, that can cause a lot of problems. Okay, so sometimes you'll see, a lot of tightness in your hip flexors, or the muscles in the front of your hips. That can kind of pull the pelvis forward, and that can put a lot of stress on the low back. Other times you'll see a lot of tightness in the hamstrings. Okay, that can kind of pull the pelvis back. And a lot of times there is weakness in the hips, which is, a big problem. So this picture on the right, you can see if you have weakness in this specific muscle called your gluteus medius, when you're walking or squatting or doing, going up the stairs, anything, if you have more weakness in this muscle on one side, and this is a pretty common thing actually, if you have weakness in that muscle, it's going to kind of throw the pelvis off, so it won't be level, and then that again is going to put a lot of stress on the low back, and it's going to kind of torque everything up the chain. So we do some specific testing as physical therapists. So we kind of test the muscle length of the different muscles that surround the hip, and we test your muscles for strength, and we kind of do some special things to help figure out where the tightnesses and weaknesses are. So stretching, the front of your hip, stretching your hamstrings, and strengthening your glutes, okay, is usually a good idea. And those are some things to work on these specific issues. But sometimes, you need somebody like a physical therapist to take a look at this, because these are kind of things that are hard to kind of figure out on your own. But there's a lot of problems that can originate from the hips. Okay, next up, the shoulders. Okay, this is a super common problem. I think we all probably deal with a little bit of this. The rounded shoulders, rounded forward shoulders. Reason is because our lives are constantly in front of us. Okay, we do all of our work in front of us, and so the muscles in the front of our body can get kind of especially tight, and then the muscles in our upper back, we usually don't do enough strengthening of those things, and so those shoulders get rounded and rolled forward. So here's a really good way that you can kind of check if this is a problem. So you see this lady here in the pink shirt. She is kind of demonstrating what rounded forward shoulders looks like. The way you can check this is just kind of stand as naturally as you can and look at where your hands are. Okay, if look at her hands, her thumbs are pointing towards each other. Okay, that means that your shoulder is internally rotated. Okay, so if your shoulders are rolled forward, they're internally rotated, and your thumbs are going to be pointed towards each other. With good posture, your shoulders will be more externally rotated, and your thumbs should ideally be kind of pointing more straight forward in front of you. So that's just kind of an easy, quick self-assessment that you can do, is just kind of stand with your arms hanging by your side and look at where your thumbs are pointing. Okay, so any type of a chest opener or chest pec stretch is always a good idea because, like I said, we always, most of us have tightness in the front of our chest because we do everything in front of us, so those muscles are usually overactive and tight. And then the muscles of the upper back are usually chronically weak in most people. Okay, so here's just a basic exercise to kind of work on that posture stuff with the shoulders. We call it the shoulder blade squeeze. So the big thing with this is you want to make sure you're squeezing those shoulders together and down. Okay, so you want to squeeze your shoulder blades down away from your ears. Okay, the common thing you'll hear from a physical therapist is try and get those shoulder blades in your back pockets. Okay, getting them back and down away from your ears, and that will really help open up those shoulders. So, we usually tell people, squeeze for about 10 seconds, do that about 10 times, or just whenever you think about it throughout the day. That's just a good thing to do. Strengthen those muscles, those scapular muscles between the shoulder blade. Okay, last thing is the neck. Okay, this is another thing, we see quite often, something that, probably everybody has a little bit of, is that forward head posture. So ideally, if you're to take a picture of yourself from the side, your ear should line up with your shoulder, okay? If your ear is a little bit forward compared to where your shoulder is, you've got a little bit of what we call this forward head posture. So I want you guys to just kind of be real conscientious of, and maybe through the next day or so, pay attention to how many times you're looking down at your cell phone. This is something that we talk a lot about with people because we all do it. We have our cell phones and we're always looking down at them, and that's kind of a bad habit, and over time that can put a lot of stress on the tissues and the joints and things in our neck. So with forward head posture, what you get is the head kind of jetting forward and the chin dumping forward. And what happens is the muscles, the neck extensor muscles, the ones in the back of your neck, just below your skull, they get really tight. Okay, and then the muscles under your chin that are supposed to keep your chin nice and tucked back, those ones get weak. Okay, so some things that you can do to work on this are stretching out the tight ones in the back and strengthening the ones in the front. And we do that with an exercise called a chin tuck. So here's a picture of an example of ideal posture. So this guy's ear in the first picture is directly over his shoulder. That's the kind of ideal situation. If that ear is a little bit forward compared to that shoulder, that's not what we want. And over time, that can kind of be stressful on the tissues. So the chin tuck, essentially, you're kind of just trying to correct that forward head posture by tucking your chin back, making a double chin, trying to get the back of your head towards behind you, and you're tucking your chin. So chin tuck, that's a very common exercise we give for people with neck stuff. The biggest takeaway, guys, the main point I want to make here is that being in any one position for too long is not good on your body. Okay, the key here is movement. So our bodies are made to move, they like to move. If you're staying in any one position for too long, that's just putting, unwanted stress on certain parts of your body. So when you're moving, things are staying lubed, things are staying good. If you're static for too long, that's when stuff starts to kind of wear and tear and break down. So movement is medicine, guys. Motion is lotion. You'll hear me say that. All right. So this was kind of a short one, but we just wanted to kind of give you some basic tips and share with you a little bit about posture. It's really important. We appreciate you guys, any of you here who are here live with us. We want you to know we are doing free 15-minute consults. So just give us a call if you have any problems. We know that there are some of you out there who who could use a little bit of extra help or guidance. Okay, we can talk about this really basic stuff over the internet, but you know, if you're struggling with something, it's really good to get a professional pair of eyes on it and get it taken care of. So you can please give us a call. Here's our emails as well. Shoot us an email. If you have friends or family that would benefit from this information, okay, you can share this with them, tag them, like, you can leave us a comment. Okay, this is our Facebook page, Physical Therapy and Balance Centers Ogden. We're also on Instagram at physical.therapy.oac, and we're putting some things out there as well. So we are, you know, we know the virus stuff is still kind of going on. Some of you may still be concerned about that. We do offer telehealth, and a lot of insurance companies are now paying for telehealth. Okay, so if you need some specific guidance or specific help, but are a bit concerned about coming in, that is not a problem, and we can see you over telehealth. So again, please give us a call if you're needing some help. So if you enjoyed this presentation, let us know. Leave us a like, leave us a comment. We appreciate you being here. And tell your friends and family, okay? Thanks for joining us, everybody.